for the patients. I take this opportunity, however, to honor them with a brief moment of silence. As a members, we understand your frustration at this time of reckoning. You stand tall, and I know that you all rise high in the preparation to fight against this pandemic. Some of you have closed their practice, closed their hospitals. Some of them you're still practicing, but definitely the way you practice has changed. It is important for the associations like IMA, IAP, NNF should do few of the important points for their members. They have to make sure to give the trusted, latest evidence-based guidelines to you all for fighting this pandemic. You are there in the forefront, ensuring the local, state, national leaders hear your effort and the challenge you face in the battlefield, being strong advocates for your needs in the hospital, clinics, and the society. Our motto should be your need, your challenge, and your insight. With this, I'll just go through what is the role of medical association per se, whether it's locally, nationally, or internationally, what we are supposed to sort of do. If you see, here, this is a site of a war which took place in 1700s in Italy. I think one of the young Swiss man, he's a businessman, he observed that almost about more than 40,000 people died in the battlefield, went around in the village, and he created the first time that national relief societies, which later become International Committee on Red Cross. You can see the emblem or the logo of Red Cross. It is actually inverted cross of the Swiss flag, which is there. So this is not the first time and not the last. I think as the Homo sapiens went across for thousands of years, there were famines, there were pandemics, there were disasters. It, out of necessity, has been given rise to Global Medical Association, because after the Spanish flu, I think World Health Organization came up. They realized that we should not sort of work in silo. It should be the whole world. We need to sort of get together and try to work in unison so that we can sort of control this pandemic. Now, during the pandemic, we look up to these medical associations that lead us through the crisis. So what is the role of medical association in this pandemic? So to steer the government in making this right policy decision, all of you, I think, has seen this. Dr. Fauci sort of telling that the American President Trump that hydroxychloroquine is not a wonder drug. It needs more evidence. And now we know that the recent guidelines which has come, the evidence-based thing, that it is not going to help in the treatment of this pandemic. Governments might be misled or misinformed regarding the magnitude of pandemic measures required. The medical association should ensure the government knows the magnitude and effect of the disease. They also should push policy Hello.
Hello, sir. Santosh, sir.
Yes.
Slide ಸ್ವಲ್ಪ ಇದಾಯ್ತು. Can you reshare ಮಾಡಿ sir slide?
Okay, fine.
Audio ಸ್ವಲ್ಪ ಪ್ರಾಬ್ಲಮ್ ಬರ್ತಾ ಇತ್ತು. Now it is clear.
Okay, should I
Share the slide now, sir.
Okay, fine. So from where it is? Okay.
Yeah.
This is okay?
This is okay, sir. Yeah. From here you start, sir. Yeah.
Okay, fine. I think all of you have sort of seen this on the TV that Dr. Fauci sort of saying that when Trump said that hydroxychloroquine as a treatment, it's a wonder drug and all that, he came out and said, no, I need to be careful. We need some evidence. And you know, all know a couple of days back, the final word patients. So government might be misled by somebody or misinformed regarding the magnitude of the pandemic measures required. Medical association should ensure the government knows the magnitude and effect of the disease. They also should push the policy regard to the protection. Definitely, we need to sort of protect our health workers, and as an association, we should give them the policy guideline what it should be. So this is again one of the doctors, Lee Wenling. He was an ophthalmologist and a whistleblower, one of the first person who said there is some unusual incidents of pneumonia occurring in the Wuhan constituency in the hospital, and some of the patients are dying with that. He was summoned, he was admonished for making the false comment on the internet, and poor Lai died at the disease because of the disease at the age of 33 years. And a voice of representation is there. Some hospitals are threatening our workers to fire them, speaking about the coronavirus shortage. So this is very important that we all need to be united, make sure that this does not happen. And also it is an obligation of the association to ensure, as I said, local and national leaders hear the voices of its members and also understand the challenge, what they face in the front line. So, are the health workers at receiving end? I think all of you have seen in recent past what has happened, whether it's ASHA worker, whether it is doctors, whether it's nurses, the way the general public is sort of behaving, it is definitely, it's not a good thing to sort of see them even in this, where their life is at this thing, and we are also sort of at risk of getting infected. So reports of the hospital administration cutting across the corners while providing PPE pay cuts. Recently, there was some of my friends from state were saying their pays have been cut by half. Though they are working, their risk has increased. Pay has been cut. I am very thankful that our Vice Chancellor Sachidanand, he has sent a mail to all the private medical college to make sure that nothing like this can happen to them. Lowering the already waning morale. What happens because these kind of things, the violence, the pay cuts, that deficient PPEs, all that defective PPEs, all sort of bring down the morale of the health workers, which are sort of fighting. Association must ensure robust support for the fellow members and ensure that the incidents of violence and opposition will not be tolerated. I think the IMA went with both the guns blazing, and government had to agree. They had to sort of take out, look and take out 1856 or the law, which sort of tells any pandemic, which during that time when the pandemic had occurred, they had taken out this law, which sort of gives them 5 to 7 years with the sentence for the violence against the health work during this disaster. And we should make sure that the public receives the right information, because now WhatsApp universities, it is so often you see so many fake news coming in that even our the mainstream TV channel
Santosh, sir.
Went on?
Sir, yeah, it got disconnected. Uh, uh, we have to start from Arnab.
Okay.
Yeah, I think the slides also got disconnected, sir.
ಸಂತೋಷ್ ಮೋಸ್ಟ್ಲಿ ನಿಮ್ದು ಇಂಟರ್ನೆಟ್ ಇಂಟರ್ಮಿಟೆಂಟ್ ಕನೆಕ್ಷನ್ ಹೋಗ್ತಿರ್ಬೇಕು.
ಹೌದಾ?
ಯಾಕೆಂದ್ರೆ ಫ್ರೀಸ್ ಆಗೋಯ್ತು ಅಲ್ಲಿಗೆ ಅರ್ನಬ್ ಸ್ಲೈಡ್ ಅಲ್ಲಿ.
So internet is afraid of Arnab Goswami.
It's okay?
It's fine, sir. Go
Yeah,
ahead.
it's fine. So we should make sure that we are sort of the association should make sure that public receives the right information, whether it's a WhatsApp universities or whether it's your mainstream media. I think you all know how the media comes out with all the sensationalization of the news. This is going to have a devastating effect from the general public or the society. So we should, as an association, people trust us more. As an association, definitely. So it's so important for us. All the most important thing is the getting the data. With changing evidence on an hourly basis, guidelines for the best practice have evolved accordingly. Because now, you know, because more and more, each peak is occurring in each country. So we are getting more and more to how do we treat? Because this is a new disease, hardly about 3.5 months old. So without this data, it's so difficult to sort of come to a sort of a protocolized treatment for these diseases. Further research is needed, especially whether it's antibody plasma therapy, whether it's a sort of a cloning of these antibodies, which a couple of days back I saw from China, I saw this one, and also whether the vaccine which is coming on. But who owns the vaccine? That is whether that country which sort of or a private company which sort of produces it going to have the owners that it is theirs. They just need to listen to what Dr. Jonas Salk said. When they asked who owns the patent on his vaccine, he said it's, well, the people. I would say there is no patent. Could you patent the sun which gives to us? Do you patent the ocean which is around us? Do you patent the river which is sort of going through us? So this is what it's very important for us to communicate with other medical fraternities, because IMA is a single body with multi-speciality. Associated medical consultant is a consultant body, and each one of us are different in a way. So it is very important for us to sort of come together with a single voice and sort of represent our members in a multi-pronged approach. As an association, we should be making sure that our help reaches the rural areas also. There are so many inaccessible areas. There are many places where you don't have doctors, you don't have the nurses, you don't have basic facilities, the rural. So
Soans, sir.
it's okay? Can you hear?
Yeah, yes, sir.
Yes, sir.
Okay,
Yes, sir.
It's fine, sir.
Also, it's very important for us to the association to have the ethics and practicality of a duty of the care in pandemics. That is very important. For example, I'll tell you the use of the ventilator. Who decides who gets it? We as an association should make sure that medical association should provide a clear-cut ethical guidelines to its members. For example, especially maybe neonatal or PICU, because we don't have a problem because all of them are need to get ventilated. But there are situations where you have some occasional ventilators are available because it's full, and you have a 90-year-old person coming and need for this thing. You need to decide. You have one at 35 years and one at 95 years. That's the time we can get into problem. Issue the guidelines on protective measures to be taken. Promote ethically sound research to inform the policy decision. What's the criteria for allocating the limited resources? As I said, priority to the patient whom the treatment will avoid premature death, use of objective, flexible, transparent mechanism, and also requires allocation policies which needs to be in writing to be explained to both the patients who are denied the access to the limited resource to the public. This is very important. Otherwise, you will have a big galata which is going on. So we should make sure it is there. Can physicians ethically deny care? This is very important because many of us, we have the consultants or doctors who are above 65, 70 years with increased incidence of a higher mortality and older people. Can we refuse use? But they can, if adequate PPE, the protection equipment is not available based on the anticipated risk level. If the physician has got an underlying health condition that puts them at extreme high risk for a poor outcome like this, then definitely I think they should they can opt out of the care. Role of the Pediatric Association, International Pediatric Association, which is an association with more than 163 countries in the world together. So has brought up high quality evidence-based child-centered guidelines. It has brought out intervention to provide the parent-to-child transmission, mother-to-child transmission. It ensured the adequate coverage of vaccination during the pandemic. It has made sure they've talked with the WHO, they've talked with the vaccine manufacturing companies, and also that adequate vaccine coverage is there during the pandemic. What about IAP? Lockdown has not locked IAP. You can see thousands of association members, students, that we have started DAP for pediatricians and the parents. National webinar, we have given them the webinars on the COVID guidelines. What about virtual conference? Because I think in Mangalore, Karnataka Pedicon was, the Mangalore Pedicon was one of the first to be affected. We had to cancel it. Epicon was cancelled. So there are so many different conferences which has been cancelled. Can we think of having a virtual conference in this pandemic? Online TOT. Recently, yesterday, I think the tuberculosis TOT was done. I think it was a smashing success with that. Postgraduate training problem. We have already started in our colleges. Postgraduate training programs are going on. Similar way, I'm sure every association can come out with a post-graduation. I think DAP has already come out with that. I think we can have that. Even NNF can have some program for their fellow students who can sort of get trained in this thing. I congratulate NNF, IAP, and also FOXG. It came out with the perinatal neonatal management of COVID-19 patients. This was one of the first clinical practice guidelines which has come out by any association in the world. Actually, this I had put it in International Pediatric Association, also in our APA.
ಹಲೋ ಸರ್, ಫ್ರೋಸನ್ ಆಯ್ತು ಸರ್, ಮತ್ತೆ ರೀಶೇರ್ ಮಾಡಿ ಸರ್.
The problem or the ಮನೇಲಿ ಕೂತ್ಕೊಂಡು ಬನ್ನಿ ಹಾಕೊಂಡು
ಪ್ರಶಾಂತ
ನಮ್ಮ ಮನೆ ನಾನು ಫೋನ್ ಮಾಡಿದ್ರೆ ಕೇಳಿದ್ರೆ
ವಿಸಿಬಲ್ ಸರ್ ಇವಾಗ ಮಾತಾಡಿ
ಯಾವ ಸ್ಲೈಡ್ ಇದಾಗಿತ್ತು
ಸರ್ ನಿಮ್ದು ಇಂಡಿಯನ್ ಅಕಾಡೆಮಿ ಇದೇ ಸ್ಲೈಡ್ ಸರ್ ಇಲ್ಲಿಂದ
This is the one.
ಓಕೆ
Yeah, this is the one.
Okay, fine. Role of Pediatric Association, as I said, the IPA has taken up an initiative and it's come out with the child-centric guidelines and intervention to prevent parent-to-child transmission. I think our IAP is also not far behind. Lockdown has not locked down the IAP. So DAAP for pediatricians and parents are there. National webinar on COVID guidelines we have come out with. Virtual conference. Mangalore Pedicon was the first one to get cancelled in this COVID pandemic. And we had Epicon, which was cancelled. Do we think of having this virtual conference? I think there's going to be a lot of change in a contact physical conference we're going to come. I think we are going to change. I think we need to, association has to evolve how we can do a virtual conference. I think as such, we were having too many conferences. I think it's a time we tried sort of a tryout with some effect, this virtual online TOT. About a couple of days back, we had tuberculosis online training program, which was a grand success, and also postgraduate training program, which is already being done in the university, in the medical college, and also IAP. I'm sure NNF can come out with some training from program for their fellows. And this is the perinatal, neonatal management COVID infection guidelines. This was for the first, one of the first in the world to come out with the neonatal perinatal management COVID-19 infection. It was well appreciated even with the IAP, the NNF, IAP and FOXG together came up. This is sort of a multi-pronged association initiative which had come, which was very well appreciated by all. What are the steps we need to be taken by a association during the pandemic? We need to sort of establish the control room. These kind of pandemics will sort of require war-like situation and war-like working. So it is like for us also, as if I was a president, what I would have done, I would have definitely established a control room where every day I would sort of have a sort of a Zoom meeting with my office bearers, at least once in a week with my EB members and the state president and the district president, so that what is happening in the periphery, keeping an eye to the ground level. This is what is very important, that we need to sort of work on this. Like, that is how the association can work, and we need to sort of, if we have to sort of liaison with the government, we need to have this a thing of a control room, and we need to sort of go all out for this. Help to assess the situation, prepare a plan, and monitor the response to the plan. Establish a chain of command and distribute the work accordingly. So you need to continuously assess the needs, identify the resources and plan, because we need, as an association, we need to have a resource list. What is needed, what we can offer, and also develop a municipal resource map. That means municipal resource map means what are the requirements? Like, for example, how many health workers are needed? What is the PP is needed? What is the drugs which is needed? This is the resource map, municipal resource map. We need to have it. Identify the gaps. What are the gaps in our treatment thing? What are the gaps in our medical health facility which is there? And this is the time we need to sort of address by the liaising with the government as well as the private field. So prepare the community for the recovery. This is also important. Once as the pandemic comes down, if you see the Spanish flu pandemic took a long time for it to come down, almost about 1.5 to 2 years. Strong pandemic management is the most important step towards the future recovery of the community following the pandemic. Activities that reduce the fear, because I think in the TV you could have seen the people walking thousands of miles, taking them on a bicycle without food. They are more scared of dying of hunger rather than getting infected with the COVID. And restore the confidence in the government and in the fellow citizen, and for their citizen to make ability to make the living, enhance and accelerate the recovery economically and also the health wise. Has this happened before? Is it the first time? No, as I said, time immemorial,
irrespective of the immunization status of the child.
it's been going
And
on. Spanish flu, 1980, flu pandemic was unusually deadly influenza. By the end, it killed more people than all the soldiers and civilians killed during the World War. In India, out of the 20 crore population at that time, I think we almost lost about 2 to 3 crore, almost about 10 to 15% of population died because of the Spanish flu. So it is very important. The decision needs to be taken in the next few weeks. If you are entering late in this, it is like you are entering a party after the party has finished. There'll be nothing but work except washing the plates. So you need to sort of enter early and get into this program. As famously Winston Churchill has told, those who fail to learn from the history are doomed to repeat it, because unless over the time we have had many pandemics. There were Ebola, there was HIV, there was H1N1 which came. So unless we sort of learn from this history, we are doomed, and it keeps on repeating. What really happened? There were no medical association during the Spanish and pandemic. So there was a lot of confusion among the chain of command, would never, because it just spread across the continents without a sort of a globalized single leadership program. So this pandemic lasted for almost 18 months and came in 3 waves. That is probable course. You can see the initial phase, then there was a huge peak and there was a second peak. So second peak of wave of flu killed a record number of health workers who already had tired of tackling the first week. So we need to protect our warriors. What should we prepare for? We need to prepare for the outbreaks due to community transmission. We were doing the sort of a finding out who had come from abroad, what are their contact and where they were spreading. I think the community transmission has just started. This is the time we make sure that further community transmission does not occur. Subsequent outbreaks may infect even more large number, because there are reports saying that the people are getting a second time infection. Virus can affect change, as seen in Spanish flu, where the first outbreak affected elderly more, but on the second wave, resulting in the large number of deaths, which was affecting between 15 to 40 years. Health worker deaths, we may see more and more health worker deaths because of high rate of exposure. Large dose of virus, because they are in continuous contact with this patients. They are overworked. 14 to 16 hours of work sometimes they were doing because of lack of doctors there, inadequate protection. So these are all sort of affecting the health worker in this pandemic. Overburden health, nobody expected so many ICU, ventilator, ICU nurses are needed for that. So increased community transmission will result in a record transmission, as you saw in Spain, as you saw in France, as you saw in Italy, and now in America. What should we do to prevent the future pandemic? Global alert and a response things, because it's very, very important for us to make sure that globally we should work as one, so that with so much of globalization, it will not be sort of brought to a single place. It's need to be sort of a globalized. There should be somebody who takes the lead. If you remember when Ebola pandemic occurred, it was Obama who took the lead. He got in G7 leaders, he got in G20 leaders. They made sure that Ebola was contained in that thing. But now you have a person who sort of looks inward because he's worried about himself. There is need to be an international leader who can take this up and make sure that we globalized as a single entity. We can, even the European Union also, each is blaming the other for the spread of the infection. A system should be put in place to swiftly identify the potential pandemic and respond with the appropriate measures. So following components are essential. We need to have strong healthcare system. You see, till now, Indian health had only about 1% of the budget for them, 1% of the GDP, where the other people, even 4.5 to 5%, were having a problem. We need to have a strong healthcare system. It's a time we give more importance. Yes, of course, there is a lot of specialities which have come in, subspecialties have come in. But our primary health need to be sort of strengthened tremendously to take care of this pandemic effectively. Dedicated medical crops, like for example, when this Ebola thing happened, there were doctors beyond borders, doctors without borders. They went there. They offered their services for them, where there was real paucity of the healthcare workers in those Ebola struck areas. Similar way, we also need to have, whenever there is disasters, whenever there is a pandemic, for example, Nipah, I think Kerala handled it very well because they had the doctors who went there from other places, made sure that everything was fine. Pairing with army and medical crop, one of the things that army can do is they have excellent logistic support to mobilize resources. So we need to sort of get with the army, the medical crops, and make sure that we can give them the best possible management. Mock pandemic response, as seen in Spanish flu, main reason for the high death was lack of organized command. So like war games in military, they keep playing this mock exercises. So can we do, should we do? The association should take part. So at least once a year, the association member should ensure national-wide response for the problems which they can face. Research and development. To prevent further pandemic, we need a lot of research because there is more and more viral. As we sort of start encroaching the environmental area of the wild animals, definitely I think there's going to be a lot of zoonosis which is coming in. We have seen forgotten disease coming back, some of the disease which were never there, chikungunya, dengue, which was never here, we are getting there. Can it be one of the topics of pharmacotherapy to social behavior modification? All these are important. So what Ben Franklin, ounce of prevention, that is what our social and preventive medicine department needs to be strengthened. Our preventive medicine needs to be sort of brought in so that we need to prevent these things. What after pandemics? How the world is going to be post-pandemic? So the surveillance, it's very important because one of the main accusation in our in this pandemic has been the surveillance. WHO surveillance was not up to the mark. Though in the beginning of December, there were some unusual cases of pneumonias in Wuhan thing. We never expected that to be such a fast spread among the humans. So we need to have that good surveillance for looking out for the resurgence of any pandemic-like illness. Protection measures, hygiene measures should continue after the pandemic thing. So social distancing has become a new norm. All the patient must be advised regarding. One of the things what I see here is that people are listening to the scientists and doctors, because when we said like social distancing, don't have the gathering, except for few cases, most of them did do it. All the temples were closed, churches across the world were closed, even for the Easter they were not open, and even the mosque were also closed, and people are listening. That means that people are still trust. That trust is the most important thing. The association should get the trust of the society to take a leadership role. All the patient must be advised regarding hand hygiene. Of course, these Swachh Bharat things like for hand hygiene, social distancing, hygiene, I hope even after this pandemic, it sort of lingers on with the society where this infectious disease will come down. Important for us to have the reserve. We need to have acquired the stockpile of essential commodities. In every state, every district, every nation should make sure that we need the essential commodities like masks, PPE. We need to have the stock so that we are not found wanting in this thing. So what is about artificial intelligence? Role of AI source in tackling COVID-19. AI can prevent exposure to dangerous pathogens at the time of pandemic. This will help to save life of many of the first responders. So definitely interpreting data, because a couple of days back I saw from Singapore about the possible the peak and the going down around the May 20th, or some of the countries by 15, some of the countries the thing. This is the data which the artificial intelligence algorithms and machine learning does. So definitely it's going to have that. Even we are using Arogya Setu, one of the apps with the government, which is helping us to sort of see where the infection is. Should we embrace the technology? Because more and more technology comes in, whether it's going to sort of have an impact on the jobs of the doctor is the thing which we need to do. So with this, definitely our association needs to be proactive with the government, make sure that we liaison with the government agencies, and so that we give a guidance to our members, our patients, government officials, and society at large. Thank you so much.
Thank you, sir.
Dr. Soans, very nice to hear your words. I really appreciate your involvement in spreading the message of Corona through websites. And I wish all the team to encourage these type of webs there in henceforth in future also. I thankful for Dr. Santosh, sir. Very nice you, and fond of your very good narration in the coronavirus on Chinnappa platform.
Thank you, Dr. Kottresh.
Thanks, Santosh, for
Prashant?
a wonderful lecture. You virtually covered all the medical associations, starting from Red Cross to IAP to NNF. It definitely gives a different perspective for the youngsters. Thank you very much.
Prashant,
Sir,
start.
yes, sir. I think people also is there. So welcome our senior most neonatal person. Yes, sir.
Can you switch on his video and the audio?
1 second, sir. I'll just talk to him, sir. Which name just saw. Anyway, we'll move on to the next topic, and then later we can do that. Yeah, I got it. Maya, sir.
Yes.
Welcome to the webinar, sir. Can you share a few words with this particular topic, sir? Maya, sir?
Yes, hello.
Yes, sir. We are able to hear you, sir.
It's only an excellent talk. I think he has put a lot of effort to make this talk great. Thank you.
Thank you, sir.
Sir, we'll move on.
Prashant, we'll take questions later. Next talk. Next talk.
We'll move on to the next topic, sir.
Yes.
So the next topic will be discussed by our Srinath Mugali, sir. Sir, over to you, sir. Sir, Srinath, sir.
Yes.
Presentation.
Hello. Prashant.
Hello.
Prashant,
Sir?
can you hear me? Hello.
Yeah. Please start, sir.
Okay. Hello.
Hello, sir.
Good evening, everybody. Good evening, Maya sir. Good evening, Kishore Kumar. I'm very happy that Dr. Maya sir is here. And first disclaimer is, sir, I'm not as good as Dr. Soans nor Jagdeesh Chinnappa. These people are sandwiched between them. And basically, I am a worker. I am not a teacher. And between the two teachers, they have been I've been asked to talk about something. And I am just talking what practically I do in this pandemic, OPD and hospital practice guidelines during COVID-19 pandemic. They asked me to talk about the tips and tricks. I think we still have only tips, tricks we have to learn over a period of time. I thank Dr. Prashant and Dinkar giving me this opportunity. I don't know whether I can meet the expected standard, but anyway, I'll try from my end as a practitioner, what I feel, what I do, and how I'm managing this. As Santosh has touched a lot of part of this Corona pandemic, we are in Corona pandemic, which has shaken the whole world. Everyone is confused. We Indians are peculiar under the circumstances. That is, basically, we Indians are, most of them or all of us are autonomous. We think autonomously, we act autonomously, and any restrictions or the rules posed on us, we take it not a pinch, we take it a fist of salt, and we try to negate it. We are good, but we need good leaders to lead us in a right direction. When this fails, then things may go very bad for a country like India. Earlier, we didn't know when the lockdown was announced, so we thought everybody has to close. But we used to get a lot of calls from our patients. And it so happened in Dharwad, one of the Tahsildar had an argument with Dr. Vijay Kulkarni, saying that why don't you open the clinics in the beginning of this lockdown? Whatever amount of pleading was not liked by him, so he went and complained to the DC of the Dharwad district. Then they all talked to the government. Next day, Honorable Chief Minister announced that all private practitioners should open their clinic. Otherwise, your license will be cancelled. Fine, we are compelled to serve. We will serve. After all, we are serving Indians, and whom else we can serve. It's a pleasure serving our children. So after this lockdown announced, patients were in confusion. They didn't know what to do, whom to contact, how to reach a hospital, because there are a lot of problems. Conveyance was not there. There was no communication, and people were laid back, especially in a city like Dharwad and Hubli. They are laid back. They say any doctor is available anytime. So that is their thinking. So they got confused. The government direction to open the clinic or you will be punished. That put us into a dilemma. How to work, where to work, and how to protect doctors, nurses, staff, OPD staff, general staff, and there were no clear guidelines anywhere. In spite of that, we started serving our young children. And you know, all of us, we never like any child crying or suffering. So we will be the first, the pediatricians are the first to attend to a child or a patient as a whole. So now when we started serving, 3 persons came into this scene. That is Deputy Commissioner, District Health Officer, and one more person called as District Surveillance Officer. So these people, they ultimately, till what I'm saying is, the government never talked to private practitioners, never never wanted that we should serve them. So now the thing has come on them. They are under pressures. So the meetings started. There are meetings again and again, and that every meeting there is a confusion. Just 10 minutes back, there was a message from one of our IMA president from Dharwad that there is no, till today, in spite of more than fifth week of lockdown, till today, no organization, private organization, rather IMA, IAP, and any other organization has any definite guidelines, any definite requirement from the government. They only come to punish us. That is the reason I just talked to one of the person there who was in charge. You always come after us to punish us, but you never tell us what exactly we should do, how we should do under the circumstances. And in fact, last Sunday, we had a meeting here when the DC had requested us to send volunteers to work for this COVID. Then we discussed and we formed a guidelines. So we told them that we will depute doctors, some IMA members, we depute some of our staff for 2 months. We will pay them salary, we will pay whatever their whatever they deserve. But at the same time, you recognize their service, give them incentive, give them protection. And till today, there is no answer from them. Only somebody from the office calls us up and asks for something. And what they need is now data. What they need, that we have to report SARE, and ILI, influenza-like diseases, and fever. In pediatrics, every child comes with a fever. And if every child with a fever, we start reporting, and these people will start harassing them. And how can they go to a fever center or a college or and wait hours together to be tested by some, I don't know, paramedics or some MBBS doctor, and again not testing them properly for a COVID. And because of this, there's a lot of discussion in IMA, IAP, peer group, seniors, juniors, yet we don't have any clarity how to go about. And what happens is, only thing what the government threatens us is that your license will be cancelled. So I don't know, we are around 1,300 members in Hubli, Dharwad. We have been in constant touch with the Deputy Commissioner and DHO. And whenever there is a meeting, they always plead that we are under pressure, doctor, please help us. How to help you? What happens to us and our workers? And if there is no clear guideline in the event of discharging our duty towards the society, either one of my staff or the doctor who contacts in a disease from an asymptomatic person and then later on transmit it to other patients, then only first thing is whether you will suffer or not is one. If you have to suffer, then you have all the problems. And the other guy whom you have infected incidentally, he is not going to leave you. Once he comes to know that it is from you, he has contacted, he is not going to leave you. Government is not going to leave you. And these people are not answering these queries, which are very, very important for us now. And more so, the worst days are coming. Once the lockdown is lifted, when people start moving around erratically, we don't know how many are asymptomatic, how many will become symptomatic. And if you have seen one of the newspapers today, they're projecting around 20,000 cases in Karnataka in months to come. Imagine if there are 20,000 cases in Karnataka, then how are we are going to work? There is absolutely no clear guideline. This all of us, including from IMA, IAP, we have to put a pressure on the government officials to give us a clear guideline in writing. And unless we get it, we may have a problems in the future, because this is not going to end here. And today as a because of lockdown, my OPD is just 20%. That is, I'm seeing around 20 to 25 patients a day. That in 2 hours in the morning. So once the lockdown opens up, that may go to 80 to 100 patients per day. And how can you do everything in that with so many reporting, so many documentation? It is going to be a hell for all of us in days to come. Now we have to plan for those days rather than what is happening now. We are at a comfortable zone, enjoying DIP, enjoying webinars, enjoying tea, coffee, food, everything. But the days after 3rd May, once the lockdown is lifted, we'll be facing a lot of problems for which we should be prepared. And ultimately, this lockdown has taught us these few terms called as social distancing. The first time our Honorable Prime Minister said that social distancing is one of the most important as far as the fight against COVID-19. That is right. Next is the masks. Third one is the sanitizer and sanitization, hand washing, PPE. These are the most important part of our practice in days to come, maybe a year or two. So now we should start preparing ourselves for this. And one more word which is coming as a senior citizens. Now, as a general population, Honorable Prime Minister said that above 50, 55 and above, you take care, don't move around, fine. But here, our medical fraternity, we have senior citizens working here. Because I don't know whether you can call it as an addiction, you can call it as a devotion, or you can call it as a whatever it is. We want to work. We are alcoholic or workaholic, or we want to work. So now, how to take care of these senior citizens? That is the biggest question which we have to answer. Now, the topic given to me, how to practice in OPD during this pandemic. Now, in reality, we have two sets of OPDs. One OPD in a clinic and OPD in a hospital and a hospital. So 3 categories we have. And in fact, I have a OPD in my own hospital. So I will give a overview of how I am working, and even that can be part of it, or most of it can be extrapolated to simple OPD clinics. So now, after government forced us, I have started working from 10 to 12 in the morning with prior appointments. But we as a second grade cities, there is nothing like civilized behavior. There will be a lot of walk-ins, and we have to cater to that. So now what I have done is, whenever people come to my clinic, this is my parking area. People park the car there. My watchman goes nearer the car and tell them that one of you come out of the car and get a registration done first. So all those who can stay in a car, they will stay in a car 5 minutes before they enter my clinic. So this is how the social distancing begins with my patient. So next is, this is a compound. The patients who come in an auto or a scooter, after getting down from their vehicle, they'll be sitting here, or they'll be standing at minimum 3 to 4 feet distance till they come in. Now, as I said, now I don't have enough crowd, so I can manage everyone leisurely and everyone is happy there. Then once they come here, this door near the shutter, one of my boy will be standing there with a thermal scanner and a sanitizer. So he will scan everybody coming in for a temperature, and he sanitizes their hand. Once they come inside, they will be seated like this at a social distancing. And one by one, they will be called into the consulting room. This is where my receptionist waiting there. She will also be wearing a cap and gloves, and we are maintaining a social distance. The patient or attendant hands over his or book from the distance. She will ask the complaints, and meanwhile she'll do the computer work, and then the patient is weighed in that weighing scale, and after that patient is weighed, the scale is sanitized. Then from there they come into my consulting room. The handle of the door are sanitized once the patient leaves out of my hospital. And when I sit, I wear N95 mask and a face shield and gloves. And luckily, I have a bigger consulting room of around 300 square foot, which is well ventilated. A lot of air and sun comes into my room. So that way, the good ventilation which is suggested, I have the one. And I have the patient sits almost around 5 or 6 feet, 7 feet away from me this side. Is missing here. So this social distancing, which now is a part of our life day to day till the corona disappears from, at least from India. So I had put that much of space in between my table and the chair. And this was planned around 20 years back. And what planned around 20 years back somehow looking reasonable in this crisis. People have asked me questions. People have fought with me for that distance at which I have kept my chair for the patients. Some of them, they asked, why did you do that? I said, in any pediatric OPD, there are 3 P's which you don't like, and 1 P which the child likes, and another P which you may experience, which you don't like others to see. The first P is peeing. Any child can pee anywhere. If the chair is nearer your table, it will be on your table only, soil everything. They poo, they shit anywhere, and they puke, they vomit. So to avoid this, I said, I have kept that chair little farther than my table. And whenever you are talking to the parents, whenever you're taking history or counseling them, it takes time. And the child gets irritable. So if you leave them down below with a toy, he is busy with the toy, you can finish your work properly. And last P for me would be, if I am in a embarrassing position and start perspiring, no one will notice at that distance. So that is an advantage of keeping that chairs there. So, and I have a thermal scan on my table. So every child, and I see before seeing, I'll scan them. If there is no temperature, then if there is a temperature, it will be recorded in the book. And since I said this is OPD and hospital, this is my hospital. This is the first floor of the hospital, the entrance. And this is my NICU. This is a 20-year-old NICU. Every time since then, we have a habit of fumigating it once it is empty, even for few hours. So now that is still continuing. Once the baby gets out of the NICU, we fumigate it. So this is how this area is kept clean. And this is the area where the OPD patient can go for nebulization and some shots if necessary, and an X-ray. So this place is sanitized with a hypochlorite or with a sanitizer, and once a week it is all fumigated. And this is my PICU bed. I have 3 beds like this, and it is fumigated almost once a week. And if I right now last since 1 month I'm not taking any patients, so it is empty and it is being fumigated now and then. So having given you a overview how I have tried to manage this, what to do next is we have to educate ourselves, we have to educate our staff. If it is a OPD, receptionist, the AYA and whatever, and in a hospital there are a lot of staff, we have to educate them about COVID, about social distancing, mask, hand washing, and PPE, everything. And now more so it is, as I was saying, that we may expect disasters after the lockdown is picked up. Then we should be prepared for that. And at the same time, we should educate our patients about hygiene, about social distancing, about mask, because without which it is very difficult for all of us to manage this situation. We have to educate them how to cough. If they don't have a mask, they can put their elbow like this and cough and sneeze. And vomitus cleaned and should be sanitized. Now, Ministry of Health and Family Welfare has given a guidance of protective gear for healthcare workers. Since this is for a thinking that anyway, I am not going to handle any COVID patients for sure. So what is most important in a setup, an OPD setup or a setup like this is N95 mask and gloves. And of course, the sanitizers. Now, since the virus survives almost for 24 hours in droplets, to avoid this, we have to wear a mask because the virus spreads from person to person to contact. The virus carrying droplets, they will dry very fast and form a droplet nuclei and remain airborne for 3 to 4 hours and landing on different surfaces. In aerosol, COVID-19 virus can survive for 3 hours, and on stainless steel and plastic, it can survive for 3 days. So now this is how we have to remember and sanitize. Masks prevent the coronavirus entering into the atmosphere as a droplet, and it prevents inhalation of those droplets by using a mask. And sometimes you can use a mask if it can be cleaned by heat or UV light or water, soaps, alcohol. But one should be sure they will be clean. And sometimes what I do is I get masks autoclaved every day and use those masks when I'm in the hospital. And when I come out, I use N95 mask. I'm sure all of us are going to see this picture in the coming days to come once the lockdown is lifted. So what WHO says, masks are the effective only used in combination with a alcohol-based sanitizer or hand wash with the soap and clean water. And it says if you wear a mask, then know how to use it and how to dispose it. Make sure that a mask fits your face well and there are no gaps in between. So now we have around 3 types of masks available for us to prevent us from getting infected, and at the same time the people also. So majority of masks are N95, KN95 respirators, facial surgical masks, and cotton face masks. N95, K95 respirators can filter 95% of the particles with an aerodynamic diameter of equal or greater than 0.2 micrometers. And they block virus and they prevent airborne diseases. Secondly, the disposable surgical masks have 3 layers. The outer layer is hydrophobic, non-woven layer and prevents droplets entering the mask. The mid layer has a filter to block 90% of the particles greater than 5 micrometer. The inner layer is, which comes in contact with the nose and mouth, will absorb the moisture. And this can be used, this is usually used in theaters for surgical procedures, and this also can prevent airborne diseases. But cotton face masks are heavy, snuffy, and they do not fit closely to the face and not very effective against viruses. However, under the circumstances in India, still something is better than nothing. At least we are encouraging every public to use at least cotton mask if they can't afford the other. Now, the capability of mask to protect a wearer is ranked as follows. N95 respirators are better than the surgical face mask. They are better than general face mask. Then they are better than the cotton face mask. So this is how it is ranked. So ideal is to have N95 respiratory mask. There are 2 types of N95 respiratory masks, one with breathing wall and without breathing wall. The one with the breathing wall makes you breathe easy. Without breathing wall makes breathing more difficult for those people who have chronic respiratory diseases, heart diseases, other diseases with breathing difficult. All masks have limited protective effect and they have to be replaced regularly. The children have a small face and you should get mask accordingly. Sometimes we see the children who are having a mask which covers whole of their face, even they can't see the floor and their parents. It should not be like that. Now, the next issue is hand washing. As a pediatrician and as a neonatologist, I cannot talk to you about this because all of us, we are so well versed, and it is proved beyond doubt that hand washing will most effective measures to prevent respiratory infections and diarrheas, because the hands are the one which becomes dirty at many occasions. So it can transmit viruses through water, food, blood products, respiratory droplets, digestive tract, in addition to direct or indirect touching. All of you are well versed with the steps of hand washing. That is not my scope to talk to you about it. If clean water is not available, what next? Alcohol-based sanitizers can be used, especially 75% alcohol is the best for this virus. So we can use, I use sanitizer after seeing every patient, and after 2 patients, I do a thorough hand washing and again use a sanitizer. So this is how right now I'm doing it, but I'm just scared what to do once the lockdown is open. We should have that kind of time, patience, and of course we have to do it. We have to inculcate that habit whether we like it or not. As I said in the beginning, we all Indians are autonomous. We want to do what we want to do, whatever it is. So the question is answered, yes, it does prevent coronavirus spread, hand washing, and 75% alcohol reduces the risk of COVID-19 infections. Now it comes about the PPE. So first discussion of our association with the administration was, please supply as a PPE. If you give supply as a PPE or you give us at a concessional rate, we will buy it and we can give it to our staff also. But Initially, they said, we'll look into it. Then they said, we are unable, it is not possible for us to get them for you. And later on, they requested that, why don't you please buy? And in the end, they put whole onus on us. If anything happens, you will be responsible for that. You should buy a PP for yourself and your staff. This is the state of affairs when you want to serve the people. At what cost? And the social media is so scary. What we see in the social media about the Dr. Simon who suffered in Chennai and others, what we are listening and hearing. And in that we have to work. Of course, PP is the one which is a specialized clothing equipment for workers for prevention against infectious material. It has gloves, medical mask, preferably N95, goggles, face shield, head covers, gowns, and aprons. It makes a barrier between the infectious material and the worker. And whenever you want to select a PPE, you have to judge the risk of exposure setting, like hospitals. I said I am not going to treat COVID, so I need not worry much about it. However, I have to take some more precautions for that. And type of the personal, like healthcare workers who are working with the COVID patient, like doctors, nurses, and all. And the transmission dynamics of a pathogen, that is contact, droplet, and aerosol. So this is how I think we have to prepare ourselves to face this pandemic. And I wish all of my friends and colleagues be healthy throughout this pandemic. We face this, we come out jubilant, we win this war, and see that everyone is happy. I once again thank all of you for listening to me, and especially I will take care of these two guys, Dinakar and Prashant, afterwards, making me to talk in front of Dr. Maya, sir. Sir, excuse me if I have made some mistake. I am a learner, I am a student, and you are a teacher. You have all the liberty to guide me and correct me. And thank you so much for everything. Thank you, sir. Thank you very much.
Thank you, sir. Thank you, sir. Sir, we'll move on to the next topic and then we'll have a discussion. This is Chinnappa, sir. You can start your presentation.
Hello.
Meanwhile, sir, yes, sir. You can start slide sharing, sir.
Yes, to stop the screen.
Sir, can you stop the screen, sir?
Okay.
That is there, that you're. Meanwhile, we have Dr. Krishna and the OV, sir, senior most pediatrician from Madikeri. Sir, we welcome you, sir.
Thank you. Thank you.
Prashant, video on maಡು.
Yes, sir. Yes,
Prashant, ಅವ್ರದ್ದು video on ಮಾಡು. Video on ಮಾಡು.
ಅವರೇ ಮಾಡ್ಬೇಕು ಸರ್ ಅಲ್ಲಿಂದ. Okay.
ಮಾಡಿದೆ. Open ಆಗಿ. Unable to start video on it.
ಪ್ರಶಾಂತ್ ಕುಟ್ರೇಶ್ ಸರ್ ವೆಲ್ಕಮ್ ಮಾಡ್ಲಿ ಅವ್ರನ್ನ.
Kotresh sir. Yeah, I think sir we will have a discussion, sir. We'll start and
Okay. Start now.
Yeah, I think sir you are visible now. Thank you very much, sir, for making time and joining the NNF, and you are our executive board member. We welcome you, sir. Krishnananda voice, sir.
Krishnananda sir.
Thank you. Whether I'm audible now?
Yes, sir. Yes, sir.
Krishnananda, you're audible. Go ahead.
Yeah, thank you, Prashant. Thank you, Dinakaran, for making me the EB member, especially from a small place like Mercury, which I'll take care of, and I'll start the academic activities. And in 2022, if possible, definitely I'll host a NNF meet in Mercury.
Thank you,
Thank you, sir. Thank you, sir. Thank you.
Jagdeesh,
Thank you, sir.
You can start, sir. Yes, sir.
Good evening, everybody. At the outset, I must thank NNF, the President, Dr. Koturesha, Vice President, Dr. Kishore, Dr. Prashant, Dr. Dinakara, and Dr. Bidri. After those two wonderful talks by Dr. Santosh, Soans, and Dr. Mugali, I will take about 20-25 minutes and talking about some of the personal and psychological issues that doctors face during pandemics. This is a new topic, and yes, all of us go through this. So I will just go through how we go. Just a couple of months back, I think all of us must be seeing this beautiful aircraft, and from there, the scenic beauty of the skies. Now, this is going to be a distant dream for most of us. The other picture, which shows that wonderful restaurant where all of us could meet together and eat, also is going to be a distant dream. Conferences, as Dr. Santosh Soans mentioned, is also going to be there. So it's almost like we are going to be on a high, and suddenly everything starts coming down. COVID was identified first in 2019 as a novel virus, spread rapidly to China, has affected almost entire world excepting Antarctica, and somewhere in February it was designated as coronavirus, and in March as a pandemic. This is some of the latest statistics on this disease. India has done remarkably well for whatever it is, and that is because our mortality is low. Number of cases as of today is somewhere around 27,000. Mortality is around only just about 700. This is compared to the rest of the world. We are luckily at the bottom for a very good cause. Normally, we are bottom for many other reasons, which is not very appreciable. But at least for this, I think we should be proud that the government has done a good job. Coming to Dr. Srinath Mughali's talk, where he mentioned that the government was not sure what kind of permissions to give, what to do, etc. Remember, they're also going through this pandemic for the first time. So when you go through the first time, it's always a learning experience. You really don't know what to do. And this is what is India. And I would introduce a good friend of mine, Dr. Shiva Atreya from the Statistical Institute, who updates this on an everyday basis. This is, if you look at India, you have an infected and a low mortality there. Karnataka in focus, if you look here, is almost paralleling India in that the mortality rates are low. The major cities that are affected are Bangalore urban, as you can see, and the others are very, very small. And if you look at Hubli, Dharwad, not even mentioned in this. And so therefore, Dr. Mughali, don't really worry about what is going to happen. The other problem has been that inadequate testing has been done. But as you can see, even when the tests have been increasing quite significantly, the proportion of positive cases is still pretty low. Now, if you look at all the other diseases, we are having a huge burden of diseases elsewhere. And just because corona disease is a pandemic, it occupies somewhere between malaria and shigellosis of all things. And this again is updated as of yesterday or day before yesterday. So therefore, this is pretty recent data. This has already been covered. I'm not going to go into it. This is just that it has new standards of personal hygiene have been set up in terms of covering your cough, washing your hands, and social distancing. And another important thing is to sanitize all the things that you routinely use. Like, for example, your mobile phone, your house keys, your car keys. And if you're using the steering wheel of your car, clothing pockets, door handles, and don't touch your eyes, mouth, and nose. And try to remain immune regularly. So this is all the things that we need to do. So what is important is not only personal care, but community care. I'm just, as an introduction, went through some of the major issues that have been advocated for the managing coronavirus. Now, there are universal anxieties, whether you're in India or America or whatever it is, on terms of PPE availability and quality and necessity, on the amount of testing that needs to be done, what kinds of tests you want to do. You want to do a PCR or you want to do the IgM, IgG. We really don't know. So there are anxieties regarding this, and the lack of ventilators, which are universal. Probably even for a rich country like the United States, they had a relatively huge amount of anxiety because of lack of ventilators. So just not enough of any of these happening. So what is happening now? I'm going to shift gears to what is happening to with coronavirus, and that is we are all in this together. We all have our individual goals and individual anxieties there. This is an interesting tweet from one of the doctors in the US who says that I'm going to separate from my family within my home for God knows how many months, so she can keep safe treating the patient and the family. It hurts because no hugs from girls, no cuddles from partner, social distancing now. But please, she appeals to people to keep social distancing to make the sacrifice worth it. So this pandemic has disrupted everything: personal lives, professional lives, social lives, spiritual lives, financial dreams, and it has done it uniformly. Everybody in every country, every social class is affected by it. We are more concerned about diagnostics, vaccines, ventilators, PPEs. But what about the mental health of healthcare workers? Is it important? So I'm going to just go through an imagination that which I all want you to go through. Just imagine that you're driving your manual Toyota Corolla to Mysore with your parents and family for a beautiful resort, to go to a beautiful resort in Kodagu. You're cruising on fifth gear at 100 kilometers an hour on a beautiful highway. Suddenly, due to some jerk on the road, the gear suddenly slips from fifth gear to first gear in a fraction of a minute. The car goes wobbly. What do you do? Well, each one of us would look at it differently. You could slam the brakes. You could take the foot off the accelerator. You could blow the horn. You could press the clutch and try to rechange the gear. You could switch the engine off. You could look at your parents at the back and tell them to put the seatbelts on. You could shout for help. You could steer the car to the side of the road. You could panic and do anything and just be paralyzed by the situation. So basically, this is exactly what is happening to all of us, because we really do not know what is the most appropriate reaction to this. So what has happened technically? You're no more living in the future. You're not planning for the future anymore, because you don't know whether there's going to be a future for many of us and what that future is going to look like. You're being forced now to occupy only the present. Corona is not Corolla. It has shifted your life gears to now. This is a life-changing event like no other. So how can you manage this change? That is going to be the focus of my talk. Well, the first step is to decide what is stressing you. Is the profession stressing you? Is there excess work? Or for example, some people, there's no work at all because the number of diseases other than Corona is not being talked about at all. There's no other disease right now, hardly there. Most OPDs are empty because parents don't want to come to hospitals and health facilities unless absolutely necessary. Other stressors could be your family. Maybe you got elderly parents who are staying with you. Maybe you got an invalid relative staying with you. Social isolation is a big problem because you don't meet people, and social interaction is a very important part of mental health. Your health may not be the best. You could be having coronary artery disease, diabetes, hypertension. Another major stressors could be your financial situation. You may be running a hospital, and if it is shut down, like Srinath Mugali must be a very, very smart man, because he must have had enough reserves for the next 6 months, 1 year. But there are many people who don't have financial reserves, especially the beginners and the youngsters who have invested a lot of money in their facilities and don't know what to do, because salaries have to be paid, rents have to be paid, the facilities have to be paid for. Then lifestyle. Some people may be stressed out because of the lifestyle change. I can't go to a party, I can't go anywhere else. And finally, there is a lot of stress in the information overload that we see. Like, for example, every day there is some bad news coming on to us from WhatsApp. There'll be somebody saying that some doctor died, somebody else died. And most of us tend to internalize that information overload or that information into ourselves. So I think this leads to two main things: anxiety and depression. And it's very, very important to look at these two, anxiety and depression, and see how you can handle the stress. First step is look at your resources. What are the resources that you have? How good is your coping skills? Next is improve your health for whatever it is. Sleep better, exercise better, eat better, take your vitamins, take vitamin D, vitamin C, zinc, whatever it is. Just take it. It doesn't matter. Have a positive attitude. Don't be a doomsday, think that something bad is going to happen all the time. Keep your assets as far as possible clearly counted and ready. Look at the family support. Look everybody who can talk, who can be of support to you and your family. Institutional support. We must all be grateful that we have institutions that will support us, like the IAP, like, for example, your hospital, like the IMA. There are institutional support which is there. And so much social support. We have a lot of friends and others who can support us in a time of need. I remember that all we need to do is to talk to somebody and say, okay, I need help for some patient, and they're out definitely then. This isn't writing. Next is, what are some of the coping skills we can do? Basically, three things. One is appraising how you can do it. Second, what are your response options? And three is implementation. Talk to get a clear idea of how you're going to cope. And who are the people that you can talk to? The best person to talk to is your spouse, because she knows you very well, or he knows you very well, and you can talk and appraise your situation pretty well. The second person who can talk to, if you have a sympathetic parent, talking to the parent. Sometimes talking to your grown children also helps. Talk to a relative, talk to a friend, talk to a professional colleague. If all these people cannot help, then you might need a psychologist to talk to, a counselor. Sometimes even talking to a priest might help you. And write down what you're going to do. Once you've done this, look at what you're going to do on a daily basis. Look at the outcomes you're looking at. What is the financial goals you have? What are the social goals you have? What are the health goals you have? What family you're going to do together? What is your lifestyle going to be? And you have to look at how your coping skills are going to alter. Write these on a daily basis. Try to put it on a weekly basis and a fortnightly review. But of course, sometimes you may land up like situations like this. Dr. Mugali has mentioned, we haven't reached here, but there's no guarantee that we are not going to reach, where we may have to even look at disposal of dead bodies, where there is no place in crematoriums to put the bodies in. So these are all things which people have faced abroad. So then in these situations, there is something called as the COVID brain. This is a very interesting term which has been used in people who have worked in really bad situations, where there's a constant state of high stress. This is written by one of the senior residents, that the COVID brain learns quickly. They are efficient by bundling orders and needs to test your limits and sometimes push you past them. There's relentless sorrow, especially in ICUs, where patients can be fine 1 minute, decompensate the next minute, and dead the third minute. So here we need to look at how this sorrow is going to be handled by you. Kindness in calamity is important, because again, the patients there are patients who can be very, very kind there. I interviewed one of the psychologists to look at what's going on in our country and our city. And she volunteers on a web-based counseling service. What she has found is most doctors are reluctant to use the service, even though nurses complain that doctors are angry, short-tempered, and smoke often. Nurses use the service often, but what are their problems? They face significant burnouts, virtually absent PPEs, isolation from family, discriminated in facilities. They're often in crowded dorms, while doctors are in 5-star hotels in some cities. Crowded buses are transported across, and virtually no social distancing. The ASHA workers, the recent Padanapura incident, no protection whatsoever, meager salaries which are not paid on time, no water to drink, no sanitizers. So if you need help, there are facilities available. All India Institute of Medical Sciences has a facility which is available. NIMHANS has a facility which is available. Sahai is a suicide helpline, but they have opened up for counseling in these difficult times. Montfort College, CIP Ranchi. Then this is a Ministry of Health and Family Welfare as a helpline, and also a website where you can go in if you need help. Then this is another interesting Green Oak initiative, where Health Work helpline is open for 4 hours a day, and it's free. You can confidentially talk if you have a major issue that you cannot sort out by talking to your relatives. So the choices are yours. Either you can react with anxiety and depression, complacency and escapism, or grit and discipline. And I suggest that all of us need to look at it with grit and discipline rather than the other two ones on top. So there's a poem for the times which I'd like to quote. Forget about yourself, focus on others. Once you start focusing on others, you will forget about all the issues that you have. Forget about profit now, focus only on relationships. Forget about sale, focus on creating value. Forget about your losses, focus on opportunities. Forget about your difficulties, focus on progress. Forget about the future, think about today. Forget about what you were, that's an old story. Focus on what you can be. Forget about events, focus on your responses. Forget about what's missing, focus on what's available. Forget about your complaints, focus on gratitude. So I think this is a very, very nice poem which will which will at least start reflecting on your difficult times. So now I'm going to talk to you about a typical day in my life these days. This is an interesting infographic which I got from the Huffington Post. Getting up, saying, oh, I'm okay. You don't even know what day it is. Probably today's Tuesday. Sitting, drinking coffee, looking out, watching television or watching the news, which is depressing most of the time. Gardening, which is very, very nice, doing some cooking, some cleaning, some painting. Then computer, of course, webinars galore, 3 to 4 per day. Feeling productive, doing some housework, eating all the time, saying I'm okay again once more, doing yoga, entertainment, reading a book, reflecting, and preparing presentations like this. Rumi's word was yesterday I was clever, so I wanted to change the world. Today I'm wise, so I'm changing myself. Thank you very much for that very brief presentation. I would just try to give few references. If anybody is interested to look at statistics on a daily basis, please go to this site, Dr. Shiva Atreya. A fantastic YouTube video by the psychologist I interviewed on dealing with anxiety in uncertain times. Please go and see this. Very, very good YouTube video. The other 2 articles which was the COVID-19 crisis and about the mental health of healthcare workers. Jessica Gold, Twitter handle is here. Then there is another very interesting by residents who have written about the ICU's pandemic view on sorrow and kindness and calamity. Thank you very much.
Thank you very much, sir. We're already getting response from your wonderful talk, and it is extremely, and I'm getting, even Facebook, I'm getting SMS. Everybody is requesting more talk from you, sir, in coming days. This is something which we all been talking about, and you really summarized it well. And I would request Dinakar sir, Kishore Kumar sir.
You have to video you have to switch on.
Sir. Yeah, and so that we can start the discussion. I request all
video
to post the question here. Meanwhile, Kotreshi sir, Bidri sir, Kishore sir, few words, and Maya sir, few words you can add for this talk.
Well, what can I say? Jagdeesh is always Jagdeesh. Number of exclamations you can put in front of his lectures. He is on the dot. He told 25 minutes. He finished in 24 minutes. And crisp, clear, carry home messages. Thank you, Jagdeesh, for excellent talk.
And regarding this today's speech, is mostly preventive aspects of the things have been highlighted well. Even in future also, like Jagdeesh, in future also you have to amend some of the systems to prevent this further spread of not even this coronavirus, and along with the other viral diseases also can be prevented. And we should follow some of the instructions from the guidelines also. And thank you, Dr. Chinnappa and Dr. Srinath and Dr. Santosh Soans regarding this event today's final.
Sir, Dr. Sir Santosh sir. Hello. Hello. Hello, sir. Dr. Santosh or Dr. Sir, Dr. Jagdeesh sir?
Yes, sir, I'm here.
Yeah, sir. I came to know that in there is 4 or 5 incidences. In Nelluru, there is one doctor. You know that I think so. I don't want to take the name. One ex-doctor, orthopedician, is died because of the coronavirus. Unfortunately, later his wife also died, pediatrician. So they opened a new hospital. So later what happened? Because of the coronavirus, the hospital was shut down. So his partners were there. The same thing has happened one more in the Maharashtra also. Because of one nurse had a COVID positive, because she was working in the other shift also, other hospital, they have closed the hospital. Suddenly, if they will close the hospital. So what happened to the hospital plight? Just imagine on 15th or 14th of day in the month, if they will shut down the hospital, what hospital owner should do? How he can give the money for all the workers? They have worked for full, almost half a day. It will be very difficult. Is there anything you can do? Because government is not giving throat swab for everybody, for any hospital. It is 6,000 rupees. What for each OPD only around 400, 500. I cannot tell the patient to pay 6,000 rupees for throat swab or the other things. what we can do, how organizations will come to help for small or medium-sized hospitals. Prashanta, video ಹಾಕಪ್ಪ.
Hello, sir.
ವಿಡಿಯೋ ಹಾಕು ನಂದು. ವಿಡಿಯೋ ಆನ್ ಮಾಡು. Sir, Santosh sir, or anybody can answer, please.
See, this is really tragedy. It has happened just a couple of days back in Mangalore also, who's staying in the same sort of our gated community doctors who are the neurologist. Has one of the patient who was admitted there for the stroke was sort of diagnosed later. Both of them died actually, and now he has been quarantined with his the whole stuff. 45. They've made him as a nodal officer and they've kept him there. So they've come negative now, but again you need the second thing. But how can any association at the moment and what way they can help is the thing, because financially we don't have. For example, I'll tell you, American Medical Association, the government had given them 100 crores, $100 billion for the thing. A part of it was for the doctors, whether there was financially they were having a problem, or the loans or the salaries for them they had this thing. But here in our setup we don't have something like that. So how we can help is we could help him in all the other ways, sort of a humanitarian this thing, speaking with the DC, then health authorities and all that, those kind of things we can help. But it is really sad, because what happens is that especially the youngsters, as the Jagdeesh mentioned, they have opened a hospital. They have to pay for the salaries. It comes to a huge amount, it can come in crores. That how long they can sustain that if they're a new entrant to the field. Even, for example, the doctors, like in medical college in one of the states, I think they have cut 50% of all salaries. So it's terrible in that way, because we don't have a plan. Association does not have plan. We are actually working in a silo for us, whether it's personal or whether it's the association, pediatric. I think we don't have such a big say with the government, because per se, what the government has given to the health private sector is meager. All the help which has gone into a manufacturing sector where there's a large number of employees, for them they've given a lot of incentives, all those things. But here for us, we have not been given. Possibly the EMIs and all that, they've helped in such a way, but it's not there. Association is financially not very strong to help anybody on that thing. You know it, Dinakar. Hello?
Yes, sir. Next.
Yes. Yeah.
Prashant, any questions?
I think one of the things where the association should work is like prepare our association for the post-COVID thing. You don't know what's going to happen, how our job's going to be, how the things to be, whether it's conferences or how the pharmaceutical industry is going to approach this. It's a big change is going to occur. I think association should work well with that thing for the what post-COVID things about. For example, I'll tell you, like the best part of our undergraduate thing was like during the break. Most of the things used to happen during the break, that classes, middle break, and all that. But now with the Zoom classes, where's the break? It's just like so many things are not going to happen. They're going to sit at home and do it. There's a lot of change which is going to come. And seeing this, whether the medical college is going to make more of these Zoom classes, we don't know basically.
Prashant? Dr. Prashant. Srinath Mugali, sir.
ಸ್ವಲ್ಪ ಇಂಟರ್ನೆಟ್ ಹೋಗಿತ್ತು
ಶ್ರೀನಾಥ್ ಸರ್. ಓಕೆ ಶ್ರೀನಾಥ್ ಸರ್. ಸರ್ ನಿಮ್ಮ OPD ಪ್ರಾಕ್ಟೀಸ್ ಅಲ್ಲಿ ಜಸ್ಟ್ ಐ ಥಾಟ್ I'll it's a don't take it as a comment because ACE2 receptors is abundant even in the skin also.
Yeah.
So off shirt is allowed, sir, because many people we are covering full.
Ideally should not be. You should cover full yourself.
Yes, sir.
Hello, sir.
Prashant.
I think he's having a problem with audio.
Audio. Oh, okay. Sir, can you see that all the questions and ask the questions, sir, please? Kishore, sir.
Oh, I can't see the questions. I just think everybody is congratulating all the three speakers.
No. There are a lot of questions are there, so no need to close the hospital. Oh, there are so many. Shantaram Baliga sir has told.
Close the hospital. There is COVID-19.
No, everybody's talk is excellent. Everybody is telling. Trying to mute. Thank you, Santosh.
Santosh, maybe you can answer this question. Right now, people are just closing the hospital, and as a policy, like if you look at any country, wherever they are treated COVID-19, that patient area, then only in India, people are closing the hospital, especially the hospital. Is there anything we can do from the IAP, IMA?
Yeah. I think we should do it because this is yesterday itself we had a problem in Mangalore. I don't know why, because there is a clear guideline from the Ministry of Health and Family Welfare that there's no need to close any hospital. Even if you see in Western countries, whether it's in Europe or US, there are so many nursing homes we are taking off. They're having a separate sort of a floor for it and they're taking care of that thing. If it is more, you make it into a COVID hospital and treat. So when there is a one case is found which was sort of a discharge, and I don't know why this is happening. I think we should, as an association, I think we'll take this up and I will talk with Dr. Bakul as well as IMA people. We have one organization of OM medicine that today itself we are having a meeting, Zoom meeting there. Dr. Guleria is actually chairing that meeting. I think I should bring this up point with him about people are closing the thing, whether it's a government, because to get their work this thing so that if they close it becomes for them less problem, whether they're doing for that, I don't know.
Sir, I will give you the 5.
No, the question, no, Santosh.
Yes.
Santosh, now the question, when we start working, now after this lockdown is lifted, now we may get a lot of asymptomatic or symptomatic patients. Suppose if you have a doubt, you suspect very strongly, where are the ways to confirm it? How many tests are being done? No.
Srinath, the problem is 85% are either the mild or just asymptomatic thing. More than 60% don't even have fever, because many of the cases which has given the infection, fine. So what are you going to do? See, whatever tomorrow, they should not say that you have missed. That is an allegation some of them have brought in for the later it has happened that.
That is
So
allegation.
you just need to have that each patient who comes to you, you have a small sort of that undertaking from them. There's no history of travel, there's no fever, there's no symptom. If you have a child with fever, cough and cold, at this present time, till we possibly the descent occurs, I think it is better to send all of them for a fever clinic. For me, I have not started my clinic yet. I go and see in the medical college in the mornings, even my private patients. So where even every child with a fever goes to the fever clinic, where they have a differentiating thing. One is a possible flu-like illness, possible sorry, and then this thing or other this thing. So they send it to that. Say, for example, they have bloody diarrhea, or they have just fever without any symptoms. They send to back to the OPD saying that thing. So there, you need to sort of instruct your person there outside who's taking with that thermal temperature thing you said, to make sure that you segregate them. Second thing is even immunization. I think you should have a separate timing for them, separate timing for the immunization clinic, where you see this non-infective possibly patients, because you have 1.5, 2.5, 3.5 months and 9 months. You're supposed to give it as early as possible. You can't sort of postpone indefinitely. So you need to sort of have a separate timing for that. And your infectious other patients, you can have it at a separate time.
So now the time has come that we have to save our skin first than doing anything. That has come in now.
Definitely, finally, it is all the herd immunity what we have to have. Huh? So and you just saw the Spanish flu, that the chart I gave, because the first attack, only the old people were affected. Second attack, 15 to 44 years old were affected maximum. But at least what I feel is we are lucky now. We know what is causing that. Imagine in 1348, when the Black Plague came, people didn't know what it was. The medical college in France, they thought because the disalignment of the stars, somebody is getting it. And the church was saying that it was because of the curse of the god, people were doing all those things. Nobody knew that. Even in 1918, when the pandemic flu was there, nobody knew why, what is causing it. They knew it was flu, but what is causing it, not. But we are lucky now, within 2 weeks, we were able to get the genome of that sequence of those viruses. We'll be able to do that. Technology has become better. I think we are going to overcome that.
Dr. Soans.
Yes.
Dr. Srinath here. Thank you very much for the excellent presentation.
Yes,
one question I have about in relation to the Spanish flu, this also may come in waves, first wave, second wave, third wave, right?
Yes.
If you look at the Singapore, initially they had only 500 cases, and all over the world they were appreciated by how they handled. They came up even with the app, and now they are facing the second wave. They have more than 10,000 cases. Like that, in India, it appears to be we are only in the first wave right now. And I think we need to learn the lessons. How can we better prepared for possible second or third wave?
See, that is the thing. Unless we have the herd immunity set in, it's very difficult for us to say. Because even you're saying there are cases from Korea, South Korea, saying that ones who are already infected, who had come, IgG was positive in them. They are getting reinfection in some of the cases. So since it's around 3.5-month-old virus, we still don't know. Unless we get the data which comes, we just have to prepare for the worst, that the second attack is there. And I feel the best thing is for the social distancing, take care of your hand hygienes, make sure that you treat with universal precaution for most of your cases everywhere, and make sure that you educate the people regarding this, because otherwise there is no medication as such. Because very unless I think vaccine is going to take a year. And I don't know, I just read a couple of days back, Chinese were able to clone those antibodies. If they can clone, then I think something we can have which can come very fast, because it's easier to manufacture the clone antibodies and rather than the vaccine itself.
Good evening. This is Pratap here.
Excellent talk. Hello.
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 Santosh, I'm Kishore here.
Yes, Kishore.
Hello.
Hello.
Yeah, I can hear you.
Santosh and Jagdeesh, Srinath, I'm Kishore here. Just wanted to ask you, the ICMR passed a resolution saying that all the pregnant women should be tested for COVID-19 5 days before the due date of the delivery. Now, in Bangalore, in spite of that resolution, we are still having problems in getting the test done for any pregnant women. Whereas in Delhi and Bombay, they can get it done easily. And I mean, this is where I think associations will make a huge difference in approaching the number of tests being available in cities like Bangalore. If Bangalore only can't cope with the number of affected human beings, I can imagine rest of Karnataka.
I think this is what that networking is the most important thing. I think unless what are the problems we encounter during our practice? What are the problems the hospital is encountering? Unless we sort of get into that, that's what I said. The association should work like a war front. That is, every day the president has to have his meetings with his OBs, maybe at least once a week with the EBs and the district and this thing, and find out those sort of a data, what problems we have need to be sort of sent to government. They may not listen at one go. If you keep bombarding with them, ultimately they are going to, this is what my experience in 2018. I was wondering why they are this thing, because once, twice, it doesn't matter. You keep going there year after year. What is happening in the association? One person comes, he goes, but he loses the link. It is the association link with the government. So it has to be maintained, that link has to be maintained for the government to listen. And what is happening is, like, for example, other things, the NGOs are basically controlling the ministries there. That's what I've seen. It's a high time we as an association need to sort of listen with them and lobby with them and offer this food.
So there were a few questions on having central guidelines in this pandemic outbreak, from Karnataka having a central system in where information is dissipated from body like IAP and the National Neonatal Forum. So what do you suggest, sir? This for Soans, sir. And we have, meanwhile, we are ex-president Lakshman Bidri, sir. Welcome, sir.
What is it, Adarsh? I didn't get the question.
So they've asked about the one central system each state should have to dissipate the information, should have the involvement of all the seniors and the association and organization should come together in one single platform. That is what they've asked. Can that be done?
Yeah, that's what I said. Any president of any organization, whether it's IAP or NNF, you have those warlike situation where he liaisons with the district people, the state people on a regular basis, trying to find out what is wrong, what we can do, where is our connection with the government, what we can sort of advise the government, what problems we have got, whether the government can solve this problem. These are the ones it works only with discussion and lobbying and networking. Otherwise, it's not possible.
Okay. Sir Bidri, sir, would you like to ask things? Sir, welcome, sir.
Excellent talk. Prashant?
Thank you.
Yes, sir.
Excellent talk. Dinkar?
sir, Santosh Soans ಎಲ್ಲ ಇದ್ದಾರೆ ಸರ್ ಲೈನ್ ಅಲ್ಲಿ.
ಅದೇ ಬಹಳ ಚೆನ್ನಾಗಿತ್ತು. But what I want to tell is that we have to live with corona. So we should start fever clinic and start reporting government. My hospital has started fever clinic. Though I am not seeing, but my junior consultants are seeing children and they are reporting every day the cases. We should have a mechanism to suspect cases should be sent for investigations.
I think so. Dr. Pratap Chandra is having some question.
One second. Meanwhile, Maya, sir?
Yeah. I have some questions and comments.
Yes, sir. Please. Yes, sir. Please.
One is to Dr. Santosh. As a body, central body, can you suggest some age groups in which they should practice, they should not practice, or limited practice, something like that, as a body? Number one. Number two, to Dr. Srinath. I think it's a very good talk. I think he has put in a lot of some guidelines. And I think that he must have been known about this pandemic because his hospital has got a very good spacing for the patients and good parking place, good social distance, very big consultation room, and all that's excellent. I think we should keep it up. Third is for Dr. Jagdeesh. I think is it wise to say that the people should reduce watching the social media and the television to reduce the risk of anxiety and depression?
Thank you, Dr. Maya, for that question. If you look at one of the major causes of anxiety in people, it's primarily because of bad news, and the bad news is basically now spread on social media. There's a constant bombardment from morning to night on social media about something that is going wrong. And if you look at the psychologists who have looked at this, and I have given a link of the psychologist whom I had interviewed. And one of the major suggestions he says is to keep the social media off for at least 6 to 8 hours a day. Look at it only 2 or 3 times a day.
The question of for me, where sir has asked, the age group restriction is very difficult. I think as now we are all strong enough to practice till, I think, like you, sir, you have been doing a wonderful job. I think only during pandemic like this, where it's infectious and senior citizens are maybe at risk, I think we can come out with a guideline. That is, pediatrician as such, we may not be able to do it. I think IMA or AMC, like something like that, they can come out with a restriction where they get rested for about a month or so, and then they come back into the working environment again.
Thank you.
Said and done. This lockdown has put us a lot of good sense in all of us. So now we used to be earlier. We used to worry that if I close my clinic, the neighbor one will enjoy the practice and all. But last 5 weeks, when we are all of us are in the same boat, that has given a lot of good sense to us. Come whatever, let's be good for ourselves and whatever who are dependent on us or who are close to us, something like that. Now that good sense, I think, is coming now. So now we are the leaders who are there. They should modify and they should see that in such a way that we should take our health as a priority along service. Some guidelines have to be prepared by the leaders and very nice people, so that we can come do something, like a good practice, so that we will be healthy and be together for few more years.
Dr. Prashant, Dr. Sidhu wants to ask some questions.
Yes, sir. He is already unmuted.
Hi, Prashant. My question is to JC sir, actually.
Yes, sir.
Yeah, sir. Good evening, sir. Sidhu here. Sir, I'm in a medical college now. Recently, we faced the situation. One of our postgraduate was COVID positive. After that, the same evening, 6 o'clock, the result was declared. 7 and 8 onward, all the interns and the postgraduates refused to work. And there was a lot of confusion and dilemma in them. And the basic thought process was they were not being provided PPE, which is not required as such scenario. So how would you recommend us to build their morale, sir?
See, if you look at the basic issue here, it is the leader who has to take charge. It is the person who is in charge of that unit who has to communicate beforehand what are the basic requirements of PPE. Like, for example, in the hospital, at Manipal Hospital, we have clear guidelines as to what PPE is required in the ER, what PPE is required in the OPD, what is required in the ICU. Okay, there is a panel which decides on the PPE requirements.
Yes, sir.
Okay, so these keep changing on frequently. For example, when this whole thing started, there was no requirement for patients to wear any kind of masks. But however, now we have moved away from that, saying that everybody should be masked. Okay. So I think the basic here, the important thing is that the unit has to decide on policy based on what the government has recommended and the availability. So I think that's very important there. The other point which I wanted to actually comment on what Dr. Mugali had said was the risk in a pediatric service is to the pediatrician, not to the patient.
Yes, sir. Yes,
Okay,
sir. Very
because,
true.
Because if you look at pediatric morbidity and mortality, it's very, very low in COVID. It's the
Yes.
pediatrician who can get affected. However, having said that, if you look at the number of deaths across various specialities and areas of work in the UK, pediatricians there are only 2
Okay.
out of 150.
Okay, sir.
And the other thing which is also interesting is both these people were not in intensive care.
Okay.
Okay, they were in, and the majority of people of the doctors who died were basically general practitioners.
Okay,
Who were
sir.
in the community. So silent transmission is taking place much more than obvious transmission. I don't know whether this checking for fever makes any sense at all, because in the initial first 2 days when the children are really infective, they may have no fever whatsoever.
Yes, sir. Very true.
So basically what we need to do is that anybody who comes to a pediatric outpatient is COVID positive unless proven otherwise.
Okay, sir. True, true.
Okay, there's no question of their having fever or respiratory symptoms or whatever, because if you look at the presentation of COVID in children, fever is only present in 75 or 80%. Rest of the 20% don't have fever at all.
Exactly, sir.
Jagdeesh,
The approach should change, sir.
Our approach is that every child who comes to you is COVID positive.
Yes,
And you
sir.
take care of yourself first.
Yes, sir. Now
Don't worry otherwise.
Now the government has made a rule, sir. Any IPD or OPD, we have to test COVID if we are suspecting, sir.
Good.
But how do we build a morale, sir, of the workers beneath us?
Constantly talking to them. See, ultimately morale is what, again, going back to the same depression part of it. Anxiety and depression. Anxiety that they'll get the disease, depression that they can't do anything much about it.
Okay.
So there are personal factors, there are professional factors.
True, sir.
So basically you need to allow them to talk.
Okay.
And I've given some helplines. So if you have really problematic, ask them to call the helpline.
Yeah, I'll do that, sir. I'll utilize them, sir. I'll utilize them.
Okay, and the psychologist whom I've given you, she's I know her for the last maybe 20 years or 25 years now.
Yes, sir.
So she works primarily with, all the psychological counseling she's done for COVID is free.
Okay, great. That's great.
Okay, so there is no charge. So you can call her anytime and talk to her for whatever reasons, fix an appointment and talk to her.
Great.
And Demands has got a helpline, Government of India has a helpline, All Indian Institute has a helpline. So there's no harm in telling them to talk, let them open up. See, the first step is to exteriorize your fear. So don't exteriorize your fear, it's going to keep running in your head.
True, sir. True, sir. True, sir.
And if it keeps running in your head, it will paralyze you. I've not gone into the effects of anxiety in this talk.
Very true.
Because the effects of anxiety can hit you cognitively, can hit you emotionally, can hit you behaviorally. Okay, so basically you need to get that anxiety out. And how do you get it? Ask them to talk. Keep
True,
talking.
sir.
So
Sure,
it will be out of their system. And then tell them, see, many times these are irrational thoughts. Like, for example, there are thoughts that you will get COVID. Even if you have 2 sneezes, people will think they've got COVID. Okay, I will give an example. Just 3-4 days back, my cousin in Bombay was running high fever. And in Bombay today, high fever means COVID.
Yes, sir.
Okay, so and on top of that, we got a blood count. She had lymphopenia.
Oh God, that's add to the problem.
So the next step. So then you do COVID test. COVID test came negative, but then you say 50% of COVID is negative.
Okay.
Testing is negative, so she still could have COVID.
Very true, sir.
So these are all stresses which you're going through because you don't know what's going on.
Yes, sir.
So the problem with COVID is its uncertainty. We don't know what's going on. And one more point which I wanted to bring up, which Dr. Soans had mentioned, is about the second and third wave. Second and third wave is something we don't know what's going to happen. We don't know whether the first wave itself is going to continue or not. Now, if you look at another study which has been done from Singapore and other places, and from Israel, they've shown that the pattern of this disease is the same in every place it has gone to. It runs its course of starting off, building up, going through a really bad phase and settling down. You take Italy, same story. Spain, same story. You look at every country has gone through the same thing of building up and going down. And countries which have stopped this build up will probably go through 2-3 waves, small waves.
Yes, sir.
So luckily for us, what has happened is that our government has handled this very well. For the inexperience that they've had, they've done a superb job. And I think we should really congratulate them for whatever they've done.
Agreed, sir. Agreed to it, sir. Thank you, sir. Thank you, sir. I got my answer. Thank you.
They're pulling more and more people. And I think Dr. Soans should now take the lead, form a COVID action committee, put in the various things that are required from the IIP Karnataka. I wish Dr. Shantraj were here. Dr. Shantraj and Ravi can be the coordinators. NNF, Dr. Bidri is there, and others are there. Dr. Kishore is there. Get together. All of us can do something. You see, I really appreciate Dr. Gunda Srinivas for setting up that beautiful helpline. It's a real boon for people. You know, where anybody, from anywhere in the country are calling in now. Okay, to get their problem sorted out. So I think there are so many things happening. What we need to do is to see where we can help out. And I think the organization like IIP and NNF and others can coordinate this joint activity. Please remember, Dr. Santosh, many of us have spare time now. And it is up to the leadership to try and put this spare time into active use for the community.
Yeah, so there are a few more questions. Is it rational to use clothes instead of mask to prevent the spread of corona infection? Srinath sir,
Dr. Prashant, the best masks are not made of the cloth masks are not very effective. They can limit the spread, but they cannot protect if you are close by. So therefore, cloth masks should be the last option. A very interesting thing which you can do and teach people is to make masks out of socks and put a tissue paper in between. Okay, that produces a very good mask, easy to make, simple to make. If anybody wants the technique, I can send it to them.
Yeah, sure, sir. And there is one more question, because when they're testing for COVID thing, they have a strict guidelines in terms of whom to be tested. So is it a time to start testing whoever is suspected or who doesn't fall exactly into the ICMR guidelines? Is it a time to do that?
Again, one more thing is that this testing thing is going to open up rapidly. Okay, please remember that Maharashtra has opened up quite significantly. It is not a problem at all doing a test in Maharashtra today. Okay, even smaller clinics are allowed to take swabs and send it, provided they have the protocol in place. Karnataka will follow suit. It's only a question of time. Okay, so just wait for another 15 days to a month's time. You'll have testing freely available. Okay, it's not that the capability is not there. The problem is today what happens is that the government is doing the test. They have to do it free. They can't do so many tests. That's all.
All right. I think we have any other questions, sir? Anybody who wants to ask? So that if there are no questions.
I would request Gowda and Dr. Dinkar to take the button now. Take the button now. What people can do.
Sure, sir. Sure, sir.
I think you two people, I think you can take the lead. We are always there. I think we can take it up. I'm there anytime now. So through IAP, I'll talk with Shantraj and also Ravi. We'll see what we can do.
Joint task force will be a good idea, sir.
Yeah.
Kishore, sir?
Yes, Prashant.
Yes, sir. Yes, sir. Any comments on before we close, sir?
I think that is a good question.
What I would say is, if you take the woman and child ministry into the loop, as far as pediatric is concerned,
I would like to add, sir,
okay.
sir, I would like to add, now the situation after clearing, the day by day, it is anyway you have to open the medical things and your OPD in hospitals also. It is a right time to have some NNF for national bodies. What is to be done, including private practitioners?
Yes.
Sir, any last comments, sir?
Sir, I would like to
I
add.
think it's a good opportunity for us, especially with the Kotresha being in the head and good connections. We should take it up with the state in the center. And especially when ICMR has issued guidelines 5 days ago that all pregnant women should be tested, and we don't have the facilities to test. I think we put that properly, because all the mothers are getting anxious because they're not getting tested. All the staff are getting anxious because they're not getting tested. So that will be a test case for us to work together. Let us draft a letter tomorrow itself and meet respect.
Bidri sir, would like to add few things, sir?
Yeah, thing is we should have all seniors should do together or have a video conference. They should decide the guidelines for how to practice, because we have to live with corona. How we have to practice? There should be some guidelines from the IAP to all the practicing pediatricians. That's all.
That's very
Lecture was very nice.
Very simple video consultation and corona beer at home.
Yeah. Thank you.
We have
Dr. Bidri, sir.
You want to add few things?
No, guidelines.
Sir, Maya sir, Karthik sir. Yeah,
No, I have told. What has to be done, I have told. Right. We should have our own guidelines from IAP.
Yeah, guidelines at COVID-19 IAP has come out with under the Dr. Digant Shastri's steward.
Hello, sir. Hello. Hello.
Sir, yes, sir. Yes, sir. Yes, sir. We can hear you.
No, a consciousness among all the seniors today is you should form some guidelines, IAP guidelines regarding future practitioners. Apart from this present crisis, you should come out separate guidelines for individual hospitals or from national activities like IAP and NNF together. Form some how to practice, how to have a clinic. There should be some proper guidelines. At Bidri said no, rightly Dr. Bidri said regarding these issues.
Sure, sir. I think, shall we close the session, sir? Yeah, and
okay, fine.
Like
I'm very happy
thank...
to see the web series. NNF is giving a very good web series have been doing for this indoor activities when the lockdown is there. So academic activities is going.
Yeah. Yes, sir. So shall we close the session, sir?
I think there is another problem from Kotresha. Maybe close it.
Yes, sir. Yes, sir. We would like to thank all the speakers for this wonderful discussion. And even though this topic was a little tricky and very practical and rational, all three of them, our seniors, have done extremely good this thing, sir. Thank you very much for enlightening our youngsters like us. We would like to have more session as you have suggested about collaborating and making a task force. Let us close the session. Thank you. Thank you very much. Thank you all. Thank you all.
Baby.
ಇಲ್ಲ ಎಲ್ಲಿ ಹೋಗ್ನ ಎಲ್ಲಿ ಬಂದೆ ಒಂದು 10 ನಿಮಿಷದಲ್ಲಿ ನೀನ್ ಬರೋದ್ ಬೇಡ ಅಂತ ಯಾಕಂದ್ರೆ ಹೊರಗೆ ಬಂದಿಲ್ಲ ನೀನು. ಏನಾದ್ರು ಆಡೋದಾದ್ರೆ ಆಡೋಣ. ಬಂದೆ 10 ನಿಮಿಷ ಬಂದೆ. ಬಿಸ್ಕೆಟ್ ಬಿಸ್ಕೆಟ್ಸ್ ಅವೆಲ್ಲ ಇದಾವಲ್ಲ ಚಿಪ್ಸ್ ಅದೆಲ್ಲ. ಮಾಸ್ಕ್ ಇನ್ನ ಇದಾವಲ್ವಾ? ಆ ಬಟ್ಟೆ ಮಾಸ್ಕ್ ಹಾಕೋಬೇಡ. ಎಲ್ಲ ಇದೆ.